Comprehensive NCLEX RN Practice Exam 5. Question 1. Mr. Rodriguez is admitted with severe pain in the knees. Which form of arthritis is characterized by urate deposits and joint pain, usually in the feet and legs, and occurs primarily in men over age 30? A. Septic arthritis. B. Traumatic arthritis. C. Intermittent arthritis. D. Gouty arthritis. Gouty arthritis is caused by the deposition of uric acid crystals, urate, in the joints, typically affecting the great toe or knees, and is most common in men over 30. Question 2. A heparin infusion at 1,500 units/hour is ordered for a 64-year-old client with stroke in evolution. The infusion contains 25,000 units of heparin in 500 milliliters of saline solution. How many milliliters per hour should be given? A. 15 ml/hour. B. 30 ml/hour. C. 45 ml/hour. D. 50 ml/hour. Calculation: 1,500 units/25,000 units, x 500 milliliters equals 30 ml/hour. Question 3. A 76-year-old male client had a thromboembolic right stroke. His left arm is swollen. Which of the following conditions may cause swelling after a stroke? A. Elbow contracture secondary to spasticity. B. Loss of muscle contraction decreasing venous return. C. Deep vein thrombosis, DVT, due to immobility of the ipsilateral side. D. Hypoalbuminemia due to protein escaping from an inflamed glomerulus. In a hemiplegic limb, the lack of muscle pump action to move blood and lymph back toward the heart results in dependent edema and swelling. Question 4. Heberden's nodes are a common sign of osteoarthritis. Which of the following statements is correct about this deformity? A. It appears only in men. B. It appears on the distal interphalangeal joint. C. It appears on the proximal interphalangeal joint. D. It appears on the dorsolateral aspect of the interphalangeal joint. Heberden's nodes are bony growths that develop on the distal interphalangeal (DIP) joints, the joints closest to the fingertips, in osteoarthritis. Question 5. Which of the following statements explains the main difference between rheumatoid arthritis and osteoarthritis? A. Osteoarthritis is gender-specific, rheumatoid arthritis isn't. B. Osteoarthritis is a localized disease, rheumatoid arthritis is systemic. C. Osteoarthritis is a systemic disease, rheumatoid arthritis is localized. D. Osteoarthritis has dislocations and subluxations, rheumatoid arthritis doesn't. Osteoarthritis is a degenerative wear and tear disease localized to the joints, whereas rheumatoid arthritis is a systemic autoimmune inflammatory disease. Question 6. Mrs. Cruz uses a cane for assistance in walking. Which of the following statements is true about a cane or other assistive devices? A. A walker is a better choice than a cane. B. The cane should be used on the affected side. C. The cane should be used on the unaffected side. D. A client with osteoarthritis should be encouraged to ambulate without the cane. A cane should be held in the hand opposite the affected leg, the unaffected side, to provide better balance and reduce weight on the painful joint. Question 7. A male client with type 1 diabetes is scheduled to receive 30 U of 70/30 insulin. There is no 70/30 insulin available. As a substitution, the nurse may give the client A. 9 U regular insulin and 21 U neutral protamine Hagedorn, NPH. B. 21 U regular insulin and 9 U NPH. C. 10 U regular insulin and 20 U NPH. D. 20 U regular insulin and 10 U NPH. 70/30 insulin consists of 70% NPH and 30% regular. 30% of 30 units is 9 units, regular. 70% of 30 units is 21 units, NPH. Question 8. Nurse Len should expect to administer which medication to a client with gout? A. Aspirin. B. Furosemide, Lasix. C. Colchicines. D. Calcium gluconate, calcinate. Colchicine is an anti-inflammatory medication specifically used to treat and prevent gout attacks by reducing uric acid crystal-induced inflammation. Question 9. Mr. Domingo with a history of hypertension is diagnosed with primary hyperaldosteronism. This diagnosis indicates that the client's hypertension is caused by excessive hormone secretion from which of the following glands? A. Adrenal cortex. B. Pancreas. C. The adrenal medulla. D. Parathyroid. Primary hyperaldosteronism, Conn syndrome, is caused by the excessive production of aldosterone by the adrenal cortex. Question 10. For a diabetic male client with a foot ulcer, the doctor orders bed rest, a wet-to-dry dressing change every shift, and blood glucose monitoring before meals and bedtime. Why are wet-to-dry dressings used for this client? A. They contain exudate and provide a moist wound environment. B. They protect the wound from mechanical trauma and promote healing. C. They debride the wound and promote healing by secondary intention. D. They prevent the entrance of microorganisms and minimize wound discomfort. As the wet dressing dries, it adheres to the necrotic tissue. Removing the dry dressing pulls the dead tissue away, debridement, allowing the wound to heal from the bottom up, secondary intention. Question 11. Nurse Zenny is caring for a client in an acute Addisonian crisis. Which laboratory data would the nurse expect to find? A. Hyperkalemia. B. Reduced blood urea nitrogen, BUN. C. Hypernatremia. D. Hyperglycemia. Addisonian crisis involves a lack of aldosterone, leading to sodium loss, hyponatremia, and potassium retention, hyperkalemia. Question 12. A client is admitted for treatment of the syndrome of inappropriate antidiuretic hormone, SIAD. Which nursing intervention is appropriate? A. Infusing IV fluids rapidly as ordered. B. Encouraging increased oral intake. C. Restricting fluids. D. Administering glucose-containing IV fluids as ordered. SIAD causes excessive water retention and dilutional hyponatremia, therefore, fluid restriction is the primary treatment to increase serum sodium levels. Question 13. A female client tells Nurse Nikki that she has been working hard for the last 3 months to control her type 2 diabetes mellitus with diet and exercise. To determine the effectiveness of the client's efforts, the nurse should check A. Urine glucose level. B. Fasting blood glucose level. C. Serum fructosamine level. D. Glycosylated hemoglobin level. Glycosylated hemoglobin, HbA1c, reflects the average blood glucose levels over the preceding 2 to 3 months, making it the best indicator of long-term control. Question 14. Nurse Trinity administered neutral protamine Hagedorn, NPH, insulin to a diabetic client at 7 a.m. At what time would the nurse expect the client to be most at risk for a hypoglycemic reaction? A. 10 a.m. B. Noon. C. 4 p.m. D. 10 p.m. NPH is an intermediate-acting insulin with a peak effect usually occurring 4 to 12 hours after administration. 4 p.m. falls within that peak window for a 7 a.m. dose. Question 15. The adrenal cortex is responsible for producing which substances? A. Glucocorticoids and androgens. B. Catecholamines and epinephrine. C. Mineralocorticoids and catecholamines. D. Norepinephrine and epinephrine. The adrenal cortex produces glucocorticoids, cortisol, mineralocorticoids, aldosterone, and androgens. The adrenal medulla produces catecholamines. Question 16. On the third day after a partial thyroidectomy, Proserpina exhibits muscle twitching and hyperirritability of the nervous system. When questioned, the client reports numbness and tingling of the mouth and fingertips. Suspecting a life-threatening electrolyte disturbance, the nurse notifies the surgeon immediately. Which electrolyte disturbance most commonly follows thyroid surgery? A. Hypocalcemia. B. Hyponatremia. C. Hyperkalemia. D. Hypermagnesemia. Accidental removal or damage to the parathyroid glands during thyroid surgery leads to a drop in parathyroid hormone and subsequent hypocalcemia, causing tetany. Question 17. Which laboratory test value is elevated in clients who smoke and can't be used as a general indicator of cancer? A. Acid phosphatase level. B. Serum calcitonin level. C. Alkaline phosphatase level. D. Carcinoembryonic antigen level. SEA, carcinoembryonic antigen, levels can be elevated in smokers even in the absence of cancer, making it less reliable as a general screening tool in this population. Question 18. Francis with anemia has been admitted to the medical surgical unit. Which assessment findings are characteristic of iron deficiency anemia? A. Night sweats, weight loss, and diarrhea. B. Dyspnea, tachycardia, and pallor. C. Nausea, vomiting, and anorexia. D. Itching, rash, and jaundice. Iron deficiency anemia results in reduced oxygen carrying capacity, leading to pallor, pale skin, tachycardia, compensatory heart rate, and dyspnea, shortness of breath. Question 19. In teaching a female client who is HIV positive about pregnancy, the nurse would know more teaching is necessary when the client says, A. The baby can get the virus from my placenta. B. I'm planning on starting on birth control pills. C. Not everyone who has the virus gives birth to a baby who has the virus. D. I'll need to have a C-section if I become pregnant and have a baby. A C-section is not strictly required for all HIV-positive women. If the viral load is low, undetectable, near delivery, a vaginal birth may be considered safe. Question 20. When preparing Judy with acquired immunodeficiency syndrome, AIDS, for discharge to the home, the nurse should be sure to include which instruction? A. Put on disposable gloves before bathing. B. Sterilize all plates and utensils in boiling water. C. Avoid sharing such articles as toothbrushes and razors. D. Avoid eating foods from serving dishes shared by other family members. HIV is transmitted through blood. Toothbrushes and razors can cause minor bleeding and should never be shared to prevent potential transmission. Question 21. Nurse Marie is caring for a 32-year-old client admitted with pernicious anemia. Which set of findings should the nurse expect when assessing the client? A. Pallor, bradycardia, and reduced pulse pressure. B. Pallor, tachycardia, and a sore tongue. C. Sore tongue, dyspnea, and weight gain. D. Angina, double vision, and anorexia. Pernicious anemia, vitamin B12 deficiency, causes classic symptoms of anemia, pallor, tachycardia, along with a beefy red sore tongue, glossitis. Question 22. After receiving a dose of penicillin, a client develops dyspnea and hypotension. Nurse Celestina suspects the client is experiencing anaphylactic shock. What should the nurse do first? A. Page an anesthesiologist immediately and prepare to intubate the client. B. Administer epinephrine, as prescribed, and prepare to intubate the client if necessary. C. Administer the antidote for penicillin, as prescribed, and continue to monitor the client's vital signs. D. Insert an indwelling urinary catheter and begin to infuse IV fluids as ordered. Epinephrine is the first-line treatment for anaphylaxis as it rapidly reverses bronchoconstriction and vasodilation. Question 23. Mr. Marquez with rheumatoid arthritis is about to begin aspirin therapy to reduce inflammation. When teaching the client about aspirin, the nurse discusses adverse reactions to prolonged aspirin therapy. These include A. Weight gain. B. Fine motor tremors. C. Respiratory acidosis. D. Bilateral hearing loss. Ototoxicity is a well-known side effect of high-dose or prolonged salicylate, aspirin, therapy, often manifesting as tinnitus or hearing loss. Question 24. A 23-year-old client is diagnosed with human immunodeficiency virus, HIV. After recovering from the initial shock of the diagnosis, the client expresses a desire to learn as much as possible about HIV and acquired immunodeficiency syndrome, AIDS. When teaching the client about the immune system, the nurse states that adaptive immunity is provided by which type of white blood cell? A. Neutrophil. B. Basophil. C. Monocyte. D. Lymphocyte. Lymphocytes, B cells and T cells, are the primary cells responsible for the adaptive, specific, immune response. Question 25. In an individual with Sjogren's syndrome, nursing care should focus on A. Moisture replacement. B. Electrolyte balance. C. Nutritional supplementation. D. Arrhythmia management. Sjogren's syndrome is an autoimmune disorder that primarily attacks moisture-producing glands, leading to dry eyes and dry mouth, xerostomia. Question 26. During chemotherapy for lymphocytic leukemia, Matthew develops abdominal pain, fever, and horse barn-smelling diarrhea. It would be most important for the nurse to advise the physician to order A. Enzyme-linked immunosuppressant assay, ELISA, test. B. Electrolyte panel and hemogram. C. Stool for Clostridium difficile test. D. Flat plate X-ray of the abdomen. Immunocompromised patients, like those on chemo, are at high risk for C. diff infection. Diarrhea with a distinct, foul odor is a primary clinical indicator. Question 27. A male client seeks medical evaluation for fatigue, night sweats, and a 20 pounds weight loss in 6 weeks. To confirm that the client has been infected with the human immunodeficiency virus, HIV, the nurse expects the physician to order A. D-rosette immunofluorescence. B. Quantification of T lymphocytes. C. Enzyme-linked immunosorbent assay, ELISA. D. Western blot test with ELISA. The standard protocol to confirm HIV infection involves an initial screening with ELISA, followed by a confirmatory Western blot test. Question 28. A complete blood count is commonly performed before Joe goes into surgery. What does this test seek to identify? A. Potential hepatic dysfunction indicated by decreased blood urea nitrogen, BUN, and creatinine levels. B. Low levels of urine constituents normally excreted in the urine. C. Abnormally low hematocrit, HCT, and hemoglobin, HB, levels. D. Electrolyte imbalance that could affect the blood's ability to coagulate properly. A preoperative CBC is used to check for anemia, low HCT/HB, or infection, WBC, which could affect the patient's surgical risk and recovery. Question 29. While monitoring a client for the development of disseminated intravascular coagulation, DIC, the nurse should take note of what assessment parameters? A. Platelet count, prothrombin time, and partial thromboplastin time. B. Platelet count, blood glucose levels, and white blood cell, WBC, count. C. Thrombin time, calcium levels, and potassium levels. D. Fibrinogen level, WBC, and platelet count. DIC is characterized by the consumption of clotting factors. Monitoring platelet count, point, and PTT is essential to assess coagulation status. Question 30. When taking a dietary history from a newly admitted female client, Nurse Len should remember which of the following foods is a common allergen. A. The bread. B. Carrots. C. Orange. D. Strawberries. Strawberries are frequently identified as a common food allergen, capable of causing various hypersensitivity reactions.